in a time like this, we have public administrators have conflicting goals. The obvious incentive to act and to act quickly, because we need to do everything we can to minimize the spread of this virus. And people, citizens, will naturally enough demand action from governments to do that and keep them safe as individuals and keep society as functional as it can be. But there's also a competing incentive to coordinate our actions so that no government does anything that's unhelpful or pointless because it's operating in conflict with actions of other governments. We need to make this stuff coordinated, and that doesn't happen at random. So intergovernmental coordination is an issue for governmental institutions at all levels: international institutions, regional institutions, the European Union, NAFTA, the NAFTA Secretariat, the Association of Southeast Asian Nations, all these regional institutions that are designed to coordinate nation states, national actors, need to be thinking about this. Obviously, national governments, subnational governments, be they provincial or state governments, local governments, municipalities, school districts, health regions, and right down to the level of individual public institutions. They need, since they are at the sharp pointy end of delivery, they need to be brought into the coordination effort so they know what their rules look like and what they can and can't do, what they can most usefully do, and where problems might lie. And as well, the breadth of the implications of these things, of a public health crisis like this, is an issue. COVID-19 is a public health crisis, yes, but it's more than that. Public health actions are creating economic implications. When we close businesses for the purpose of keeping people safe, when we strongly encourage, indeed in some cases require, people to self-isolate, stay at home, all that stuff has economic implications. As Chris mentioned last week, what we're having in the economy is a supply shock recession, because nobody's able to go to work and produce things. And of course, economic decisions can increase population health risks if we don't think about the population health implications of what we're doing for the economy. As a certain head of state to the south of us is demonstrating. And indeed, the next few slides we could think of as a game of, so how big a nut bar is Donald Trump anyway? So what we are seeing, both good and ill. One headline, coronavirus, anger in Germany over report Trump is seeking an exclusive vaccine deal, from the March 16th Guardian. MPs and ministers criticized display of self-interest and accused the US president of electioneering. Well, yeah, this is a problem. And again, thinking in terms of intergovernmental coordination, what can the international community do to ensure that there is not an exclusive arrangement for a life-saving vaccine or a cure that might get discovered? Because the point of stopping a pandemic is, or one of the strategies for stopping a pandemic, is getting vaccines, cures out to as many as possible, as quickly as possible. Number two, as Trump muses about easing restrictions, all eyes are on the border. The Canada-US border is becoming a serious issue. CBC News, March 23rd, any move President Trump makes to lift restrictions is likely to be blocked by state governments. So again, we're having a coordination question. If state governors are seeing the national government acting in a way that is problematic to them, they are going to use their powers as state governors to protect their citizens, their residents, naturally enough. So we avoid this messy conflict if we coordinate, but frankly, in the absence of a president who wishes to coordinate, the state governors have to step up to do that which they need to do to keep their citizens safe. And another one, March 24th, US could become coronavirus epicenter as Trump talks economy, and it looks like it is becoming that. Another one, March 25th, coronavirus impact spreads across the US with much of the population under stay-at-home orders. Now, interestingly, as I read that article, trying to figure out who issued the stay-at-home orders, both the state governments and the federal government in the states can issue such orders and are doing so. Don't know whether that's through coordination or good luck, but they are using their powers to act for the good of the population. Here in Canada, it's March 24th, Trudeau says most premiers don't think Emergencies Act is needed yet to cope with COVID-19. Reasonable people can disagree with that. I know our premier thinks that the use of the Emergencies Act to create a consistent national playing field would be good, and there's something to that. On the other hand, all the provinces have quarantine acts that do give them power, so there are ways to coordinate and ways to coordinate. I think we're actually seeing a good conversation in this country among our first ministers about how we do this well. And I think it is, to my mind, less politicized than it is in the States and much more focused on how we get this right for Canadians. So Ontario closes all non-essential services, March 23rd. And this is an interesting little New Brunswick story. UK doctors headed to province after getting clarity on travel restrictions. Family of 2 doctors and their children were not sure what closed borders meant for them. This is for March 24th. What had happened, of course, because healthcare is provincial jurisdiction in Canada, presumably the provincial government had recruited a couple of doctors from the UK to come to New Brunswick. And they were about to come to New Brunswick when the federal government, which has jurisdiction over our national borders, closed the borders. And they went, what's going on here? And the provincial government went, oh, this is a problem. We would like to have our docs here. So my understanding is that there was a federal provincial discussion about how to manage this. And the upshot is, I believe what's happening is this family, 2 doctors and their 2 kids, are flying into Montreal, and they're self-isolating for 14 days in Montreal, and then get to come to New Brunswick. Well, that was a potential conflict that could have done real harm to, real tangible harm to the healthcare system in New Brunswick at the time we needed it most to be at its best. That got sorted out through a conversation that led to a coordinated federal provincial action. So the question in all of this is, how do we decide who should do what? And we actually have some guidance on managing this stuff that could be useful in an emergency. In the EU, we have the subsidiarity principle, and you'll remember me prattling on in the fall about the subsidiarity principle. In Canada, we have, under the peace, order, and good government power of the federal government, something called the national concern test. So subsidiarity. The principle is that nothing should be done by a larger, more complex organization, which can be done as well by a smaller and simpler organization. It comes out in Article 5.3 of the Treaty on European Union. Under the principle of subsidiarity, in areas which do not fall within the union's exclusive competence, the union shall act only if and as far as the objectives of the proposed action cannot be sufficiently achieved by the member states, either at central state level or at regional and local level, but can rather, by reason of the scale or effects of the proposed actions, be better achieved at the union level. So it's not decentralization for everything all the time, but it's, let's think about how to do this smart. Sometimes decentralization works better, sometimes centralization does. We have a similar phenomenon for the national concern test under the POG power in Canada. For a matter to qualify as a matter of national concern, it must have a singleness, a distinctiveness, and an indivisibility that clearly distinguishes it from a matter of provincial concern. In other words, it's got to be a thing, and it's got to be something that is important to the country as a whole, and has to work for the country as a whole. So another criterion to consider is whether the failure of one province to enact effective regulation would have an adverse effect on interests external to the province. In other words, if one province doesn't act on the national consensus, will the intended action be undermined? If that's the case, then you have to turn to the feds under the peace, order, and good government power. So at the end of all of this are two questions that I think are worthy for our discussion at the end of this. Who should act in a circumstance, right? Who's the right actor? And the other thing is when to act and when to consult. And the question of when to act and when to consult is really where I want to turn it over to Dominic, because as Minister of Education, he acted quickly to close the public schools in this province, caught a little flack for it at the time, but clearly did the right thing. Acted quickly, but I think not precipitously. So I'm just interested. I think Dominic can provide us with a good real-world case of how to move quickly, but in an intelligent, considered fashion. So I want to pick Dominic's brain on the thought process that went into the school closure decision here in New Brunswick. Over to you, Dominic.
Thanks, Ian, and thanks for the chance to be part of the discussion today. So the process of closing the schools in New Brunswick was one that, as education minister, I'd been thinking about for a period of at least 6 weeks prior. That my life prior to working in politics in New Brunswick, because I worked in international development and democracy building around the world. And through that, it developed a lot of links with people who worked in the public health realm. And I was often working in countries that still were subject to regular epidemics and outbreaks of infectious diseases. So I just happened to have connections to people in that universe. And so over the Christmas break, when the news of the coronavirus started to roll out of China, I was paying attention to it because it was the sort of thing I was naturally interested in, which may be probably unusual amongst most Canadian politicians. So over the course of the next few weeks, I was attempting to put pressure on my government here in New Brunswick to try and talk about planning for a possible pandemic, as it looked increasingly inevitable that one would arrive on our doorsteps. Not a question really of if it was going to happen, but when, as unfortunately has been shown to be the case. And with my responsibilities as education minister, I viewed it sort of along two paths. First, clearly, my first responsibility is to protect the students and staff inside New Brunswick's public schools. And at a secondary level, also any actions I took in education were likely to have an impact on my colleagues who would recognize that if I was moving ahead on a file, that perhaps there was reasons for them to do the same. So I, from early January, was collecting regular reports from the WHO and other experts and beginning to build the case for why we needed to take urgent action, being familiar with the principles around flattening the curve and so on. So the process was of collecting information and trying to push that through the regular government decision-making channels. And it was interesting because, of course, in a public health crisis like the COVID-19 outbreak, in many cases, people look to their public health officials, which I would argue, especially based on this experience, and you can see increasing levels of concern expressed around this in other provinces in Canada, that it's not necessarily always the best advice. And I think that's for two reasons, and they both sort of link into the nature of federalism. That in a country like Canada, we have a tendency with our provincial medical health officers, they talk to each other, they talk to their federal counterpart. But of course, they're all operating in a context of being in a very advanced country with sophisticated healthcare systems, and that those benefits have privileged us in that we've been long protected from outbreaks of major infectious diseases, at least ones that threaten the lives of large parts of the population. So in light of that, I was noticing an increased tendency towards being very small c conservative in our public health officials, saying there is no risk, not really a problem, don't have to worry about this. And as provincial health officers referred to each other's statements, and I think the federal health officer referred to the provincial statements, there was a tendency for everyone to an extent, drink their own bathwater. And when I would try and push into those discussions, arguments coming from other bodies, whether it was public health officials in China or Italy as the outbreak worsened there, or the World Health Organization, it was hard to get traction for that because we have such a well-established and often rather insular system here in Canada. Of course, one of the probably the things that unites us most as Canadians is our belief that our public health system makes us unique and special, especially in contrast to the US. Unfortunately, that's true in some cases, but I think sometimes we overestimate that as being something that distinguishes us, and it does cut us off and encourages a tendency to be somewhat parochial in public policy approaches. That's a bigger question. So the advantage, though, of a system like Canada's is that if one province moves, often there is a tendency for other provinces to take inspiration from that action and to move quickly in return, in response. So as I was able to gain increasing levels of support in the face of the growing evidence from around the world about the coronavirus's spread and move towards closures of the public school system with lots of difficult and long conversations with people throughout government here in the province, I very quickly noticed the second we made any moves at all in that direction, that they were replicated elsewhere. And that's been seen not just in education closures across Canada, but in the border closures, invocations of states of emergency and other practices. So again, the same tendency that can make federalism be slow to act in times of crisis at the initial point, once things get rolling, there can be a tendency for everyone to say, well, everyone else is doing it, so we better do it as well. That has some positive and negative effects. One I would highlight that's received some attention here, it's getting into sort of the minutiae around education, but a lot of provinces, when they closed their daycare systems, shut them down completely and immediately offered full payments to all the parents who were affected, who had been paying to reserve spots in a daycare system across Canada that's largely private. And in New Brunswick, we didn't do that. We said, look, we need to set up an essential workers program here for the children of essential workers, which doesn't just include people in the hospitals, it includes people who work at Tim Hortons or other retail outlets where we're considering those to be important to provide services to people who have to continue to go outside during the pandemic. And other provinces where, again, went with a much more generous, you could say, approach, but one that didn't take into account those needs. And now after a week, we're seeing again, a lot of provinces replicating what we're doing in New Brunswick. So the benefits of us having taken a more cautious approach there and resisting the sort of the federalist tide over the course of a week or so were definitely apparent. But at the same, so again, I think it's fascinating on a case-by-case basis, the way that the structures of our federal government and the provincial and federal jurisdictions overlap and sometimes conflict with each other. But Ian, to your point around the different perspectives on the use of federal emergency powers, that gets the heart of some of these interesting questions. And I think it's going to be a fascinating conversation when this is done about how we look to revise and reform the way that we manage some of these structures, because despite the generally now coherent response across Canada, there are still gaps and differences and deficiencies. When you look at Canada's approach to testing aggressively for COVID-19, we've been out of step with best practices for months and continue to be. And there's no reason for that. And we could have done better. And I think there are going to need to be strong, long conversations at the end of this about strengthening our public health regime, the way in which it interacts with elected officials as well. And I'm just looking forward to us getting back to normal and being able to have those conversations. I hope that was of use.
Thank you very much.